Hello, my name is Christopher Jones, Associate Professor of Orthopedic Surgery at UCLA, and I'm honored to introduce the top cited article of 2015. The study entitled Outcome of a Combined ACL and ALL Reconstruction Technique with a minimum 2-year follow-up was published in Volume 43, Issue 7. I had the pleasure of interviewing the author, Dr. Bertrand Sonnery-Cotet. First, I asked him, what has changed the most with regards to your approach to ACL surgery over the last decade? He remarked, my current approach to ACL surgery is defined by the philosophy, think outside the notch. It is increasingly clear that differences between all major autograft choices are small, and that in order to really improve outcomes for our patients, we must focus on comprehensively addressing secondary restraint lesions. This includes not just the anterolateral structures, but all important lesions. A currently topical example of a frequently missed or neglected but important injury is the ramp lesion. These meniscocapsular injuries have important biomechanical consequences that are likely an important contributing cause for ACL graft failure. I strongly advocate for routine trans-notch visualization in all patients at the time of ACL reconstruction, since the sensitivity of MRI is limited, and without posterior compartment viewing, a high proportion of ramp lesions are missed. Next, I asked, given the significant amount of research in the field, how has your approach to lateral extraarticular ligament augmentation evolved since the publication of this paper 7 years ago? His response, there have been numerous good quality comparative studies from groups across the world showing significant advantages of combined ACL and ALL reconstruction, particularly with respect to reduced graft rupture rates over isolated ACL reconstruction in high-risk populations, including young patients participating in pivoting or contact sports. Also in professional athletes, in revision ACL surgery, in those with chronic ACL injury and hyperlaxity, and in those undergoing medial meniscus repair. This wealth of clinical data, without any evidence of increased complications, has led to an approach where 76% of the 500 ACL reconstructions I performed last year were in association with an ALL reconstruction, 17% were performed with a modified Lemaire, and only 7% without lateral extraarticular procedures. This evolution in practice has allowed a retrospective, long-term, matched pair series which has confirmed that this strategy has really been important in improving outcomes. In this series, we demonstrated that the risk of graft rupture is greater than 5-fold higher in those who underwent an isolated ACL reconstruction in this time period. Next, I asked Bertrand, what is the future of ACL surgery? He replied, we are currently working on understanding the complex mechanisms and pathophysiology of arthrogenic muscle inhibition and how it affects our patients in the post-injury and post-operative periods. On the same subject, I will defend my PhD on brain functional MRI following an ACL rupture at the next Congress of the French Arthroscopy Society. I am also involved in a fantastic project of augmented reality. Finally, I asked, given your significant research contributions to the field, what is one pearl of wisdom that you can give to aspiring surgeons who want to have an impact in the field of sports medicine research? He stated, the most important pearl is to establish a database and collect your outcomes. Good clinical data is essential for high-quality, impactful work that can change clinical practice. We all thank Dr. Sonnery-Cotet for his scientific contributions and congratulate him on this honor.